welcome back to Patient Knowledge. I'm Dr. Kirmani, and today I will be talking about an important vitamin, vitamin D. So let's get straight into it. This video will give you information regarding the functions, benefits, deficiency and factors responsible for it, some of the important symptoms of vitamin D deficiency, and towards the end of the video, there's a list of foods that are rich in vitamin D. Let's talk about the functions of vitamin D. The most vital function is regulating the absorption of calcium and phosphorus. It also helps to facilitate the normal functioning of immune system. Vitamin D is important for normal growth and development of bones and teeth, as well as improved resistance against certain diseases. Now, if your body doesn't get enough vitamin D, you are at a risk of developing bone abnormalities such as osteomalacia, where the bones become soft, and osteoporosis, where the bones become fragile. Various studies have shown some surprising benefits of vitamin D. Vitamin D fights diseases. According to a 2006 study published in the Journal of the American Medical Association, it suggests that vitamin D may also play a role in reducing your risk of multiple sclerosis. According to 2008 findings published in Circulation, it shows that vitamin D reduces the chances of developing heart disease. Now, vitamin D also elevates your mood and wards off depression. In one study, scientists found that people with depression who received vitamin D supplements noticed an improvement in their symptoms. In another study of people with fibromyalgia, researchers found vitamin D deficiency was more common in those who were experiencing anxiety and depression. If you are trying to lose weight or prevent heart disease, consider adding vitamin D in your diet because it boosts weight loss. In one study, people taking calcium and vitamin D were able to lose more weight than subjects taking placebo supplements. The scientists said that extra calcium and vitamin D had an appetite-suppressing effect. Here are some factors that can affect your ability to get sufficient amounts of vitamin D through the sun alone. Now, living in a highly polluted area, using sunscreen, spending more time indoors rather than outdoors, living in big cities where buildings block sunlight, and having a darker skin. These factors contribute to vitamin D deficiency in an increasing number of people. That's why it's important to get some of your vitamin D from sources besides sunlight. Here are some symptoms of vitamin D deficiency. It can range from tiredness, aches and pains, general sense of being unwell, to severe bone or muscle pain. Some people may experience difficulty climbing upstairs. There could be some severe cases where there are stress fractures, or people may have problem with walking and have a waddling gait. Now, its diagnosis is confirmed by a simple blood test. If your doctor finds that you have got very severe symptoms, the doctor may also advise X-ray to check the bone strength. And the treatment is simple by taking vitamin D supplements. That has to be taken every day for at least 3 to 6 months or even longer. But there are several times where you should be taking vitamin D for better absorption. And the best time to take is the morning time after breakfast when your tummy is full. So this will have a better absorption of vitamin D. The worst time to take vitamin D is before bed because it interferes with your night sleep cycle or the circadian rhythm, and that's why it's not a good idea to take it during nighttime. Here is a list of foods rich in vitamin D: salmon, sardines, egg yolk, shrimp, fortified milk, cereal, and yogurt. That's all for today. Thank you for listening. I hope this information was useful in understanding everything about vitamin D. If you want more these kind of videos, help my channel by support my channel by liking, subscribing, and sharing it. Bye for now.